Yeah.
So what I'm going to start with is what the milestone that we go through as we age. And I'm going to start with the skin. The skin produces cells called stem cells, as we all know. And we also get exposed to sunlight, the ultraviolet A and B. Both of those cause us to wrinkle, cause pigmentation, and damage to the epidermis. We'll talk more about it as we move on. The vessels that we had, arterial and venous, are exposed to plaque deposit, which predispose us to stroke, heart attack, and hypertension. Our bone and cartilage become thin, leading to arthritis and degenerative disc disease. Our bladder dysfunction and prostate enlargement cause frequent and difficult urination. Financially, we become vulnerable and can be taken advantage of. We experience restless sleep due to the decrease in hormonal production, stress, and others. Our immune system weakens, will become vulnerable to infection. These last three categories that I mentioned is what we're going to discuss today. Move on, our brain cells atrophy over time and lead to loss of memory and dementia. Exposure to environmental toxin increase the risk of cancer, and our GI is vulnerable as well and lead to nutrition deficiency. Next.
So you'll just hit your.
Do I do this?
Yeah, he'll follow your screen. There you go.
No,
Was that two?
it jumped.
Oh,
That device did that. It jumped.
there you go. Yeah.
So first, we're going to talk about sleeping disorder, which is very common in general and especially in individual over 65 years of age. And there are three categories for the insomnia. The first one, it's called insomnia, which is in which we have difficulty falling asleep or staying asleep throughout the night. The second one, called sleep apnea, which is experience of normal pattern in breathing while we are asleep. There are several types of sleep apnea. The third one, called restless leg syndrome. I don't know if any of you experience that. That's when you jerk as you try to go to sleep and it keeps you awake. Next. So what causes sleeping or difficulty sleeping, sleeping disorder or difficulty sleeping? As we get older, the deep sleep cycle decrease, which is due to lower production of what we call a growth hormone, melatonin, and the gamma aminobutyric acid. Stress, depression, medication also can cause sleeping disorder. Poor sleeping habit, irregular hours sleep, alcohol before bedtime. Health problems include frequent urination, muscle pain, lack of exercise, sleep apnea, and lack of sunlight, and too much of brain activity before bedtime. So we have to avoid that. What is the side effect of insomnia? So if we don't sleep enough, what will happen? Why we're concerned? First of all, the immune system. Lack of sleep increased inflammation, insulin resistant, comfort eating, and weight gain. Cytokinase, which is an enzyme produced by the white cells in the blood, we'll talk about it in a minute, plays a significant role in defending infection and is significantly produced during sleep time. So if we don't sleep enough, we don't have enough of cytokinase. During sleep, the immune system activity significantly increase. So it works better, and all of the white cells and lymphocytes and other things that we'll talk about is significantly increased during sleep time. Cardiovascular, there's increase of blood pressure, heart rate, which is due to release of adrenaline, cortisol, norepinephrine. Those hormones are produced during awake time. So if we have a long day with production of those hormones, our heart rate keep going up and our blood pressure will increase. As far as the brain, insomnia causes difficult concentrating, anxiety, mood swings, and depression. How much of daily sleep do we need? Adult and senior need at least 7 to 8 hours. Teenager need more, 9 to 10, and children need over 10 hours a day. What's a non-pharmacologic intervention for sleeping disorder? First, turn your bedroom into a sleep-inducing environment. No TV, quiet, dark, and cool. Maintain constant sleep pattern. We should sleep at the same time every evening and wake up at the same time. So that's a routine. CPAP can help to avoid apnea and sleep better. We develop soothing bedtime ritual before we lay on the bed. Physical intimacy help. Avoid stimulant such as caffeine, alcohol intake before bedtime. Adequate daily early exercise. Early meaning during the early afternoon or morning. Otherwise, you don't want to have exercise before bedtime because it wouldn't work well. Avoid too much stimulation. Nap early during the day. Take a snack before bedtime. Reading or listen to soft music. Avoid watching TV or using computer. Meditation. Meditation is a habitual process of training your mind to focus and redirect your thought, increase awareness of yourself and your surrounding. The advantage is enhanced sleep, stress relief and control anxiety, improve concentration, enhance the immune system, and decrease blood pressure. The technique is repeat mantra to yourself, whatever you want to choose. I use Our Father art in heaven, and it helps. Whatever you use, it's always good to repeat as you go to sleep, and then hopefully soundly you will get to sleep. Make meditation part of your daily routine, at least 20 minutes a day. The type of meditation: progressive, mindfulness, breath awareness, yoga, spiritual, loving kindness. Any of those work. Type of exercise, as you all know, daily housework. If you move around the kitchen and the living room and dining room and do a lot of work in the house, that's good exercise. Walking, jogging, cycling, gardening, mowing the grass, strength and aerobic classes help. Swimming is very, very good also, if you have a chance to do that in the summer. Yoga and Pilates and Tai Chi?
Tai Chi. Yeah.
Tai Chi. What kind of medication we can use if we do not respond to the non-pharmacological intervention? First of all, is the medication should be used for a short term and only if it's affecting our quality of life. The sleep-induced drugs does not substitute for natural shut-eye and normal sleep pattern. So keep that in mind. We have over-the-counter medication and prescription medication. The over-the-counter is very common and people use it, and it has less effect as far as habitual and addiction. Delayed release melatonin, sleep adopt is one of them. It's combination between melatonin and GABD that we talk about. Antihistamine may help. Unison, Advil PM, Tylenol PM, all of this is commonly used. It can cause some addiction and tolerance, but not as bad as prescription medication. The prescription medication involved antidepressant became very popular now, and it's possibly better than the insomnia medication. And the most common one now is Remeron. It's used in very low dose, and it helps the person to sleep. The insomnia medication, Ambient is one of them, Sonata, all of the rest, they're all medication that you need a prescription from your primary physician. What is the side effect? Physical and emotional dependent is the most common side effect. Memory loss and impaired motor skill. And there are a lot of studies show that dementia increased risk by using sleep medication. There is natural sleep aid that has less addictive component, include Rosarem, Balsorma, Selanor, and others. If you need a copy of this, I can also send it to you. Let's talk about the immune system and advanced age. What factor compromise the immune system? First, advanced age, and that's why we're talking a significant issue for aging. The second one is cardiopulmonary and kidney disease. So if we are old and we have kidney disease or a heart condition, it increases the risk of deficiency in our immune system. Diabetes, smoking, autoimmune disorder, obesity, ethnicity also has a lot of impact on immune system. Race and social economic status, stress, lack of exercise, and intimacy also impair our immune system. I jumped. Sorry. You're not following this, right? You just go, yeah.
He's
no,
clicking
hold
to the
on.
next one.
Yeah,
So
don't there. This one is going too fast. I clicked something that.
We're on slide 15.
So now I want to talk about why we as senior has immune disorders. First of all, longevity is determined by the process that act on lifetime antigens exposure and the healthy immune response. So we build up over the years the immune system that it became stronger and tolerance to a lot of pathogen exposure. ACE2 that you possibly heard about receptors increases with age and associated with comorbid condition. What the ACE does, it allows virus to enter cells and bacteria and any other pathogen. So as we get older, our ACE receptor increase. If you look into children, ACE receptor are very limited. Therefore, their chance of viral infection as such as COVID-19 is much less in children than adults. The stem cells number decrease as we get older, and it's important to have those stem cells to produce all different cells and tissue in the skin, the GI, the lungs, and the immune system as well. Thymus hypertrophy increase with aging. And why it's important? Because T cells, which we'll talk about in a second, it's the most important cellular immune system that is being produced by the thymus. And the thymus in aging and senior limited the production of T cells. Neutrophil macrophages are also compromised with aging, and I will show you a picture of those. Imbalance, nutrition, and vitamin and minerals also have impact on aging and immune system. The one thing important to just mention quickly that we as human are exposed to many bacteria and virus and pathogen throughout our lifespan. We are colonized with multiple endogenous and exogenous viruses and bacteria as normal biological immune balance against pathogen. We must have it, and that's what it keeps our immune system strong. Our body produces about 10 viruses particle a day, part of our genomic DNA. We must have that. It protects us from other pathogens as well. Human exposed to new viruses almost every week, every month, and we have all the mutation of virus also comes into the picture here. This is a little bit congested slide, but it summarizes all of the immune system as we get exposed to pathogen. In the middle, you see it said pathogen, and you have little dot. These are the virus and bacteria that invading the body. The first, we have 4 defense mechanisms. The first one is the skin, called physiologic barrier. And we'll talk about it in a second. The second one, after we pass the skin, if we don't fight, if we could not protect ourselves from the skin, the mucosa of the mouth or the upper respiratory system, we move to the next defense mechanism, which is the second one called innate immunity. And we'll talk about it in a minute. In that section, this is also what we were born with. This is something the gene makeup of our body is what innate immunity is. It includes macrophages and cytokinase that we talked about previously, that it will be produced by those white cells, neutrophil macrophages cells in the blood. The third one is a messenger between innate and acquired immunity. So between the second mechanism and the fourth mechanism, we have the third one that we have special kind of cells called natural killer cells or the sentinel cells that it communicate, it stimulate the white cells in the second defense mechanism and to talk to the cells in the fourth defense mechanism and stimulate them to produce antibodies and immune system. And that called humoral immunity, which is the last part. And as you see, the bacteria started in the pathogen upper portion of the slide in the middle, and slowly it narrowed down to the end. And that's how we then fight against any pathogen enter the body by blocking the interference or the entry of those bacteria to the body. To make it a little bit more simple, the first defense, as we talk about the physical and chemical barriers that include tears. Tears wash microbes and lysosome, which is an enzyme that it kills the pathogen. The skin, sweat produces what we call the dermocidine, an antimicrobial peptide, and it also destroys viruses and bacteria. On the right, the saliva secrete leukocytes, enzyme inhibitors. Respiratory tract is the most important part of our chemical barrier because that's why we get the infection from the virus or bacteria and cause pneumonia. And what happened with the respiratory tract, we have a lot of cells that sweep the organism upward, not allowing it to enter the lungs. And there were a lot of phagocytes, which is white cells, that it produced cytokinase and it destroyed the virus or the bacteria before it entered and caused pneumonia. The stomach has a pH that also kill organism. So this is the first barrier for any infection entering the body. The second one, now, before we go to the second one, we talk about how can we take care of our skin to prevent the entry of the pathogen to the body. The skin is a physiologic barrier against pathogen exposure, as we talk about. Regular exercise, healthy food, and adequate sleep will enhance and improve the skin property. We should stay always hydrated to keep the skin healthy. Never expose yourself to sun without sunblock. If you look at the picture, the upper portion said dead keratinocytes, which is a part that is thick in children and teenager and younger adult. When we get older, that layer of dead cells get much less, allowing the pathogen to enter the deeper part of the skin. The next one is called the living keratinocytes, which is the one that also defends us against pathogen. And the lower one, if you see that in blue, it's stem cells, and that's the one that we need to keep healthy because that's the one that produces all of the cells above it, the dendritic cells that keep our skin healthy. How we can enhance our endogenous stem cells. Stem cells is a big issue now, and it's being used for therapeutic of a lot of disorder in human. In order to keep our stem cells healthy, we have to have balanced nutrition and exercise and maintain appropriate weight. These are the three main categories that stem cells, as we get older, remain healthy and less dysfunctional. The second defense mechanism that we show you on the previous slide, it's called the innate immunity that's present at birth and prior to exposure to pathogens. So we have it, and it's influenced by our gene. Some people have strong gene, and therefore they are strong fighting the pathogen that enter the body. But some of us are not don't have any strong gene, therefore we may not be strongly immune to those pathogens. The first line defense is called white blood cells, and that's what you have it routinely checked out by your primary physician to see if it's normal, which is between 5 and 7,000. Those pathogen is the first cells that it attack the pathogen when it enter the body, either through the skin, respiratory, mouth, or any other part of the outside the body. It destroys the pathogen, and it also informs the adaptive immune cells to respond. Secondly, so beside the white cell, we have cytokinase. You probably heard about it. Cytokinase is produced by those white cells, and it is very important as an immune defense mechanism because it phagocyte and kill the pathogen. So we must have a healthy cytokinase production in order to keep up from being infected. The innate immunity, this is a picture on the left side. It's all the white cells that we see, and the phagocytes and the macrophages. All of those cells work hard to keep us away from infection. Cytokinase is being produced also by those cells, and an important factor in the innate immunity. The third one, or the last one, this should be the first one that I skipped the one that it gives you messages. It's called acquired immunity, produced by the exposure to the pathogen. So this is how we build up immunity as we get older. And this is the part that we need to stay strong in order to keep it healthy. And it's two parts. On the left is active immunity, on the right is passive immunity. The active immunity can be natural or induced. Natural is developed after exposure to antigen in the environment. The induced one is developed after administration of antigen to prevent disease. The one on the right, passive immunity, it's either induced passive immunity, which conferred by administration of antibody to combat infection. That's what we use with COVID-19 now. We give the antibody that extracted from human who get infected with the virus. The natural passive immunity is when you get infected with the virus and you build your own immunity. So those on the right is passive immunity. On the left, it includes your natural acquired immunity in your blood and your gene, and then the exposure to vaccine and others. The two important cells in the defense mechanism for the adaptive immunity is the T cells on the left and B cells on the right. The T cells become memory cells, and it stay for life. It protects you as we get older. The B cells produce antibody that also protect us from any pathogen comes to the body. The problem with the B cells that the antibody can wane away and disappear over time. The T cells memory can stay for life. So we want to keep our T cells healthy in order to keep up what we call it the memory cell immunity. And then the antibody, hopefully, if we get vaccine, we produce antibody. If you get natural infection, your body will produce a lot of antibody, can protect you for at least a year or more. How we enhance our system, our immune system. First, the diet, and then exercise and meditation, stress release, and adequate sleep, as we talk about. The nutrient that boost immune system include Mediterranean diet is one of the popular one. Probiotic and antioxidant, we'll talk about it in a minute. Vitamin and mineral, excuse me, vegetable and fruits. Herb include garlic, ginger, green tea, turmeric, and also poultry and fish. What is a Mediterranean diet? It's usually mostly fish, vegetable, and fruits. It also has new studies show in 21 that improve microbiome and longevity in individuals who predominantly take Mediterranean diet. What is probiotic? It's a live microorganism, when given in adequate amount, provide benefit within gut immune system. So it work in the GI. It include lactobacillus, streptococcus, bifidobacterium. These are all bacteria, healthy bacteria that we have to keep it intact in our GI to stay, to keep it healthy. It interacts with intestinal epithelial cells and protect us, and also produce the T cells and cytokinase to help fight organism. If we eat the probiotic-rich food, we can destroy the effect of it. Probiotic-rich food include yogurt, kefir, cottage cheese, sauerkraut, kimchi, kombucha, if you heard about it, pickles, olives, things that it kind of rotten or not rotten, that we use vinegar for when you process pickle, olive oil, many other products. Dark chocolate is one of them, and cheese, and so on. The next one is antioxidant. Antioxidant is enzyme that protect us against oxidative stress. What's the oxidative stress is? Anytime you get exposed to any stress, we build up free radical in the blood, and we need to have antioxidant to destroy it. It includes beta-carotene. The antioxidant is in beta-carotene, vitamin C, vitamin E, selenium, antioxidant effect, and improve immune system function. Consumption of plant-derived antioxidant is adequate for daily requirement, and systemic synthesis antioxidant can be toxic with excessive use. So we don't want to use too much of antioxidant. And the food that is rich is dark chocolate again, bacon, beans, beta-carotene, vitamin C, E, D, zinc, all of those, blueberries, strawberry, consider antioxidant factors. Vitamin is very important, so we all have to take multivitamin on a daily basis. Vitamin D enhance the function of T cells. Vitamin B affect the humoral and cell-mediated immunity. Vitamin A, it's called anti-inflammation vitamin. If you have lack of vitamin A, you may have also prone to have infection. Vitamin D comes from the sun. Exposure to it in decrease with aging. So we get older, we go to the sun, we sit 20 minutes, we don't get adequate amount of vitamin D. But if a child or a teenager sat in the sun for only 5 minutes, they get over the 800 international units per day. So for us, we needed at least 800 international unit if we're over 70, and 600 international unit if we're over less than 70. And those are included in the multivitamin that you take on a daily basis. Vitamin C is very important as an antioxidant. Vitamin E and zinc. Zinc is an antioxidant involved in DNA and RNA replication and production of immune cells. Food rich with zinc is whole grain, dark chocolate, lamb, nut, shellfish, egg, and beans. Remember, the absorption of those nutrients more enhanced from dietary source than oral supplements. So you want to get natural vitamins, not just, it's rather more important and better observed in the GI than the vitamin that you get it from the store. Exercise, we talk about it, enhance your immune system as it does to sleep. Intimacy and benefits also the immune system. And there's a lot of studies show that the increased T cells and B cells by intimacy. How about financial abuse? I'm going a little bit fast because we're running out of time.
You're okay. Don't rush.
No rush. Okay. Our average retirement expenses, based on 2020, senior over 65 spent an average of $55,000 a year. Our spending depend on inflation, when you retired, where you retired, and your longevity, if you know what's your family history of longevity, what age you withdraw Social Security, and your lifestyle and health status. Your lifestyle is very important of how much you spend for what, as far as the cost. Where all of our average expense goes to. Health, the most cost is average $8,000 a year, and increase as you get older. Food, $2,000 a year. Entertainment gift, $3,000 a year. Housing expense, $25,000, include repair, utility, property tax, and so on. Traveling, if you do, roughly $5,000 a year, and then miscellaneous cost. All of this added to your expense, annual expense. How can we manage our financial need? Meet your advisor at least once a year and choose the right equity for your retirement. Be sure you have a will, trust, or power of attorney. Diverse your investment. Your growth potential should count the rate of inflation. Unfortunately, this year is going to be high. So with safe investment, you should be able to walk away with your principal plus interest rate. Choose the right annuity that fit your need.
I didn't
How
pay
can
him to
we
plug that
manage-
either.
How can we manage our money wisely? Avoid high-risk investment. Keep a lid on spending. Take minimum risk beyond your need. Rebalance and diversify your portfolio at least once a year. Gift your children whatever you can and witness what it's being spent, how it's being spent. Estimate how long you might live. Do not place all of your portfolio in one basket. This is what the GDP, the percentage of health expense from the total of GDP, which is going up from 15 to 20, and it's increasing every year. Prescription drug expense going up every year. We don't know where it's going to end. And the Medicare Part 1 and A and B, C, and D is all moving up. So our healthcare is going to be more expensive as we move on, year to come, and as we age. How can we maintain our investment money? Keep it healthy and not lose it. Place at least 50% of your money in interest-bearing saving account, such as U.S. saving bond, certificate of deposit, or free risk. There are free risk and yield 1 to 3%. Money market, limited rate. Unfortunately, we don't have too much of interest rate in money market or certificate of deposit nowadays, or even bonds, certificate U.S. bond. But at least if you get 1 to 2%, better than nothing. And it's also the most important is that your money is safe. We get older, we don't have to put our money in any risk that you may lose, such as the stock market. Treasury securities, T-bill, T-note, T-bond, and treasury inflation protect your security. Low risk dividend paying stock. Annuity investment is an insurance products, monthly payment guarantee income, high interest rate, then CD, bond, and money market. So keep that in mind. Rental income is good if you have a couple of homes or apartment and get money through that. Now, how can we protect our asset? How about financial abuse and fraud? This is one thing we need to be careful about. In general, 36% of abuse and fraud is a victim that we know who is a perpetrator. Family member usually, or friend, or caregiver. A conservative estimate of annual loss is about $3 billion and more, possibly more now. Recent studies show that over 300,000 ultra fraud scam reported every year. Type of scam. Telemarketing scam is the most common. As you know, I get about 10 to 15 a day. Robocall, it's all robocall, selling product, medication, IRS scam. The caller pretend to be from IRS, demanding you pay debt or before you get arrested. Grandchildren, friend scam, asking for bailout money, self-insurance scam, and pharmacy scam. Online fraud, it's called phishing and spoofing, process of collecting your personal information through email or website claiming to be legitimate. Spyware and viruses are malicious programs pretended to be legitimate, embeds into your computer and monitor your activity and collect information. Very dangerous. Pop-up window used to obtain personal information. Credit card and bank account scam. Be careful how you use your credit card and to who. Door-to-door and con artist scam, also a problem. How can we limit telemarketing scam, which is the most common one? Do not answer your phone unless you're expecting a call or there is a caller ID, or if someone is calling you and want to reach you, he'll leave you a message, so let him be. Unidentified or unknown number are considered scam until the proof otherwise. Always label all phone numbers to the name of the person you know, the company that you have dealt with. Anytime I get a call from an insurance, even if I don't have it in my directory or contact, I will put it in and then erase it later on if you don't need it. So I will know if they call me back, that's who they are. Block all unknown telemarketing. If you're not sure about an urgent phone call that left you a message, call friends and ask them if they had similar call experience. You will see, not surprised. What should you do if you think you are a victim? Call your bank and credit cards company and verify your balance and expenses. Reset your ID and password. Call your financial advisor. That they're in a good position to spot fraud attempt and can work with someone else on your behalf if needed. Set up a power of attorney and other legal document in advance, so you don't have to worry about it at the time it happened. Contact Adult Protective Service Agency. ARP Foundation is one of them. Tips to prevent senior fraud scam for family. Do not buy from anyone who calls or visit unannounced or from unfamiliar company, or write your credit card information for donation. Sign up for do not call list and remove yourself from multiple mailing lists. Never give your credit card, bank account, social security over the phone unless you initiate the call and you know the person. Be an informed consumer. Take the time to call and shop around before making a purchase. Always read all contract and purchasing agreement before signing and be sure all of your requirement has been met. And for protection, our family should watch carefully what's going on with us. If there is any unusual recent change in the person account, atypical withdrawal, difficulty balancing checkbook, new person added, sudden use of ATM or credit card, unpaid utility, rent, mortgage, or other essential bill where you have the money, but it's not paid for, a caregiver not allowing others to access senior account, that happen a lot, pile ups, sweepstakes, mailing, magazine, subscription. A lot of senior, they love to get into those and think that they're going to get a free gift. There's no free gift. It's all scam. This is a connections that you can, hotline that you can call, may help you. Almost on time now. So as we get older, how can we keep on track? Take care of yourself, make priorities, know your weakness, remove from temptation, set clear goals and be consistent, focus on motivation, enjoyment, self-control. We are wonderful the way we are. The sign of age on our face, our beautiful sign of life lived. The lines around our mouth and our cheek are from many years of laughter and expression. Our eyes may show our sorrow, but it's part of who we are. Our face is a map of our life. Not all are given the privileges to grow older. We are perfect just the way God made us. Embrace it, stay healthy, and enjoy life at its fullness. Thank you.
Wow. Thank you very much. That was a lot of information.
Yeah, I went
and-
too fast.
No, you're fine. And
Unfortunately.
what we'll do is we're going to make this available through our YouTube channel. So we can email out the link to you. That way it's not,
Yeah.
if we emailed you, you can watch it on your own time, and we're looking forward to using this. This is one of several part series that we're going to be doing with Dr. Hadeed, and I believe it's very beneficial. And this is one of the things is that we were talking about the senior abuses or fraud, is they really like to segregate you from not contacting your family or trying to shame you into doing something that you shouldn't do. So, just make sure that you know that you're not alone. And I've dealt with this quite a bit with clients that were being taken advantage of. So, that's really a concern for me, because I know that people have worked hard for what they have, and we want to make sure that they're protected. So, ask sometimes those questions that aren't comfortable for you to your parents. And this is one thing I have noticed is not being able to bounce checkbooks.
Yeah.
I've seen that quite a few times with clients, and it's one thing that you just kind of keep after that. So I think, do we have any questions?
We have
Any
a couple
questions?
comments. Cindy says, thank you so much, Dr. Hadeed. A fantastic presentation and lots of great information. Patty says, thanks, Dr. Hadeed. New information to think about, Patty. Thanks, Joel, too.
Okay, all right.
Nice.
Yeah, if anybody has any question, I unmuted everybody, so you can speak now.
Yeah, and also we'll be we'll let you know on the next date for their next follow-up. And I had the list of them, but I don't know what it is now right in front of me. So, but we'll put you, if you're in our weekly email, we will be getting that out to you. And oh, hey, there we go. We see everybody
nice.
now. Okay, all right.
Hello.
Good to see you, Keith, Cindy, Patty, Shyla. So, and then Carol is up there. We see you. Hi. So, all right. Any other questions or comments? All right, we're good. And so just go to our YouTube channel. What is it, John? I don't even know.
F. Joel Financial.
F. Joel Financial under YouTube, and we'll have that in our library. Okay. And we'll be looking forward to seeing you next time. Thanks.
Thank you for coming.
Thank you.
Have a good day.